This is Mario, who has recently decided to pour both his heart and talent into the creation of a website. He wants to raise awareness of Crohn's as well as raise money for the disorder. Hi, Mario. How are you?
How you doing?
I'm fine. Mario, what exactly is Crohn's?
Crohn's is basically an ongoing disease of the digestive tract, and it can affect any place from the mouth to the anus.
Okay. Do you know what causes Crohn's?
Not necessarily. Some doctors say it's genetic. Some say it's things that you eat. Some say it happens over time. You know, it could be from drinking, from any number of things. No one exactly knows what Crohn's is and why it happens to so many people.
So it could actually have to do with environmental conditions.
Possibly, definitely.
Okay. When did you first learn that you had Crohn's?
Well, it was 2004. I really didn't take it that seriously because, I was young. I was, 24 years old. I just got back from Iraq for the first time. I went over in 2003 and I came back and I was just having like all types of problems like running stool and constipation. My eyes were very, very irritated and they were like swelling up. And just a lot of different things were going on. I didn't know what was going on. I just thought maybe I had like hay fever or the flu or something. I was getting feverish symptoms, and it didn't really matter what I ate. I was just having problems. I figured, maybe it was from dehydration or maybe not drinking enough, fluids and getting enough electrolytes in my system. But
so you were only 24 when you first found out?
Yes, ma'am. Generally, the age, it can be anywhere from 15 to 35. Most people find out they have it. It doesn't affect any specific race or gender. A lot of people don't even know they have it. They just think, they may have like IBD or something similar to that. Or IBS, I'm sorry.
And what is IBS?
Irritable bowel syndrome.
Okay, thank you.
It has basically the same type of symptoms, but like Crohn's is that to the 10th power, as far as I've been told.
Okay, do you remember where you were and what your feelings were when you were first diagnosed?
Okay, I was in Fort Riley, Kansas. I was at the basically TMC. It's basically like a doctor for military people, military personnel. And I kept going back because I was having like this steady diarrhea, and when you go ahead to have diarrhea there, you don't go to work for 24 hours. So this persisted like 8 days. So, they told me they gave me more water. They gave me like promethazine pills, and for swelling in my stomach, they gave me ibuprofen, like 800 milligrams, and like nothing was stopping it. I pretty much couldn't leave anywhere comfortably away from a toilet or, a bathroom facility, latrine area for probably about 7, 8 days. And the only place I would go was obviously there every morning because I had to go check in because I couldn't go to PT. And I just didn't know what was wrong. I tried everything from Pepto-Bismol to Imodium. I think I tried some type of Alka-Seltzer at the time for the stomach. Just nothing worked. So they ran some tests on me. They obviously had to take stool. They took urine samples, blood samples. And like 3 or 4 days later, I called in. I had an appointment, and they told me I had Crohn's. At the time, they basically told me, yeah, Crohn's is something you can live with. Lots of people have it. It's not that big of a deal, and you're not going to die from it. But what I didn't know at the time that it could also cause a lot of other things that happen. Colon cancers come from Crohn's, can possibly come from Crohn's, intestinal cancers, just pretty much anything to do with your digestive system. All the way to the extent of possibly cancer or basically needing an entire, surgery to replace your intestines, which I kind of need at this moment. And you get all types of hassle. One doctor says you need it, another doctor says you don't. But right now I have at least 3 doctors saying I do need it. And it's a very expensive surgery, and pretty much insurance companies do not like to pay for this. It's well over $1 million unless you get some type of help or you get the okay from an insurance company. They normally don't care. It's not them, it's not their kids, they're not affected by it, and they just look at it as, oh, it's Crohn's disease, they read on apparently, and they say many people don't need this. But everyone basically that has had this has had like a high success rate. At one point in time, they tried to put me on Humana, which, it worked for a while. It made the symptoms not appear as often, and sometimes they didn't appear for weeks, months at a time. But it seemed like when my body got used to Humana, no matter how high the doses they gave me, it came back with a vengeance. And it was like I was hospitalized. I was literally hospitalized just last year in Brackenridge for 9 or 10 days. What happened at that point in time was my legs swelled up, and they basically had to drain my leg. I didn't have any cuts, I didn't have any scrapes. My blood circulation just wasn't acting right, and my food wasn't digesting well, which caused that to happen. So every day for about 9-10 days, they had to put me on a antibiotic called Vimoxilin, which had to be injected through my vein. It's about a 3-hour process because regular antibiotics for me don't work anymore. And it's definitely taken a toll on my life. And my grandfather and my grandmother, they both died of colon cancer, and my grandfather was known to have had Crohn's when he died, and he had, they found the Crohn's in him long before they found colon cancer. My grandmother, not really for sure, but just the simple fact that it happened to me, I really don't want it to happen to anyone I know, not even my worst enemy. I wouldn't wish that on anyone, and I definitely hope it doesn't happen to my kids, because if you don't know what's going on, if you don't know what the problem is, it's kind of hard to find a solution. And if it does happen, I'd rather know a lot earlier than later, because I have a lot of knowledge about it. Like you say, I just literally started a foundation, the American Crohn's Foundation, at AmericanCrohnsFoundation.org. We're also on Twitter and Facebook. We don't have a large following, like many people don't know anything about us. But we're literally just getting off the ground. It's not just, people getting on Wikipedia or, someone I live that life every day. I suffer this every single day. And I'm not looking for some type of pity party. I just really want to raise awareness and let people know that there's a lot of people dealing with this. And, until you actually get seen and tested by a doctor, you don't even know what's going on. You might think that, okay, right now I'm taking Pepto-Bismol every day, or, if I eat this happens, but you don't really know why it's happening. And I think everyone should at least go see a doctor. And if you've seen a doctor before, I think you might want to go get a second opinion if you have any of the symptoms. Anything from bloody bowel to diarrhea to not using the bathroom for over a week at a time. I just think it's important that people know about this.
Are there other symptoms that you've mentioned symptoms a couple of times that you can think of that people might look for?
Well, being that we're having an interview, you would think I probably would have dressed a little bit nicer, but my stomach tends to swell up, and I like to wear looser clothing when this happens. Like one day I might have a flat stomach because I'm not naturally a heavier guy, and the next day I might wake up and it's like I have 5 extra inches of stomach. It doesn't matter if I've eaten anything in particular or if I drink a certain amount of fluid, I mean, even water. I have flare-ups a lot, and, you know, a lot of eye irritation. That's one of my main problems. Mainly what I have is bloody bowels. I've actually, I forgot to tell you this, like twice I've actually had to get parts of my intestine removed. I'm not even going into detail on how that was done, but like it was more like you get this done or you're gonna have problems. This is something that can't wait till tomorrow, or you know, this is something you can put off. And there's certain medications I can't take, like I don't take medications for pain in general. I'm not really into that. I've never been big into pain medication, but you know, like I can't even take a regular Vicodin for pain as a you know, some people can. I would have to take like a ibuprofen, which is basically the same thing, but obviously I'm allergic to Tylenol. It has an effect on me. The bloodiness in the stool. I can't take certain cold medicines when I get a cold. Certain ingredients in certain breads I can't eat. Like, it was kind of like, you know, I was living a life of serving my country, and I was literally enjoying life. And this just literally came out of nowhere. And when someone tells you you can't drink soda anymore, or you can't drink, or you know, you can't drink alcohol, or you even have to stop drinking milk, or it's tough. You can't just do that all in one day. So like I said, when this originally happened, first couple years, I did not take this seriously because I'm a soldier, I'm a man, you know, like I have pride, like, you know, I'm not one to go. At one point in time, I didn't like to go to doctors. And I felt that, what's the big deal? I'm going to be okay. I've always been okay. So how is this going to stop me? I'm a survivor.
Okay. You mentioned that you have had surgery several times. I know that people have a lot of intestine. Do you happen to know how much of yours has been removed?
Probably, honestly, it's well over 4 feet. And it's not just been, you know, where they take a foot off here, a foot off. It's been like 6 inches here, 2 inches here, 3 inches here, you know, and it's fused back together basically. But it's getting to the point where I really don't have much large intestine or small intestine left that's good. So basically, I've been told, as I told you, the transplant would be the best option, but telling it to insurance companies is not always, you know, what they want to hear. When it's talking about them spending money, no matter how much money you've had to spend towards this to get right, it's it doesn't always go your way. I understand, you know, like, it's not their problem.
But it is yours.
Yeah, it's mine. It's, you know, it affects my kids, it affects my family, it affects work. You know, I work a lot, constantly. You know, like, it's not like I'm looking for some type of pity party, like, I'm like, oh, I just want to lay in bed all day. Like, this is...
Well, let me ask you this. We've talked about how it affects you physically, what it does to you. What about emotionally and socially?
It could be awkward at times because I can't, you know, like, you know, the Super Bowl just passed the other day. And, like, lots of people went out to party, lots of people hung out and, you know, did their whole Super Bowl thing. I love football. I love basketball. Like, I'm heavy in the sports. I played baseball as a kid. I did very well. You know, I had a lot of opportunities, but chose the military instead. It's like, I like to be able to go to like a barbecue and just hang out for hours and hours and just hang out with my friends, or be able to go to Super Bowl parties and chill for 3 hours. But you never know when you're going to be flared up, or you need to use the restroom, or it's awkward sometimes. It's really, really hard when you have to go to the grocery store and read the back of every label, and all of a sudden, oh, I've been here for 2 hours reading labels, so I have to use the bathroom. Like, so I have to, I have to time a lot of things, and like, I have to be careful if I'm going on a long road trip. Like, try not to eat too much or eat the wrong thing. Like, I can't just pull up to a McDonald's and say, hey, let me get a Big Mac. I love Big Macs. Who doesn't? I mean, who doesn't love a little fast food, Taco Bell, or want to grab a pizza? Simple stuff. Or, my daughter's having a play or something, and it might last 2 or 3 hours. You want to be there. Excuse me.
Take your time.
Well, I don't know.
You just mentioned your daughters. I understand that you have 2 girls. And I think you sort of answered this question, but I'm going to ask it anyway. How does Crohn's affect your life with them?
I mean, to be completely honest, it makes me love them more. I guess not having time to do a lot of those things gives me a lot of time to think about them and spend with them, and to cherish the fact that, it's not something worse. There's people with worse things going on, just as many problems, if not more, than me. So at the end of the day, I'm just grateful that at this time and point that they don't have anything wrong with them. They're healthy, and they're blessed by the man. And every day I do thank God that he didn't allow worse things to happen. I try not to think about what's bad going on, and I'm thankful for the good things that I do have going on. So at the end of the day, I'm just happy that they're okay. It's not a big deal, like, you can still love someone with cancer. You can still love someone if you have HIV. Why can't you love somebody who have Crohn's? Like, love doesn't stop because of problems. I just wanted to raise awareness, and I appreciate you giving me this time to share that.
It has been my pleasure, and one more time, would you tell us the website?
It's the AmericanCrohnsFoundation.org, and it's basically, I'm going to start putting websites on there. I did go to the Cordon Bleu, so I'm pretty much a chef, not a master chef or anything, but just to show some people some pretty cool recipes that they can put together themselves, and to try to keep their family healthy. I'm not telling you to go out and run 10 miles on a treadmill every week. I mean, that's cool if you can do that. I'm not telling you to hydrate every 5 minutes. I'm just basically letting you know that just change a few things in your life, because it happened to me. It could happen to you.
Mario, thank you so much, and the best of luck to you.